Good afternoon, everyone. I'm pleased to be here to provide an update on COVID-19 in Alberta. Dr. Hinshaw is taking some much-deserved time off this week and so is unable to attend today's update, but will be back next week. Today, the numbers I'm sharing are from Tuesday, March 22nd to Monday, March 28th. As always, the detailed breakdown of data is available at alberta.ca. Let me begin by talking about two key leading indicators that help us assess the level of viral transmission in the province: positivity rates and wastewater surveillance. From March 22nd to 28th, our daily positivity rate of PCR tests ranged from 21.7% to 27.1%, with an average of 24.5%. This is a slight increase from the 22% average in the previous 7 days. The wastewater surveillance data also shows signs of rising transmission. A number of sites across the province, including Edmonton and Calgary, are showing initial signs of increasing trends. However, as we know, wastewater data can be highly variable, so we will continue to monitor these levels and other leading indicators in the coming days and coming weeks. Given that we have lifted the vast majority of public health measures over the last 7 weeks, it is not unexpected that we are seeing a slight increase in transmission of COVID across the province. There are simply more opportunities for the virus to spread as more and more people work from the office, return to traveling, socialize in various settings, and resume their regular routines. This is especially true as BA2 Omicron subvariant is a dominant strain in Alberta and is shown to be more transmissible than BA1. Our lab has found that around 70% of all positive PCR test samples are now BA2. Fortunately, the available evidence does not so far suggest that it causes more severe illness than the previous Omicron strain. At this point, we continue to have capacity in the health system to address the other surgical and medical needs of Albertans. Since our update last week, hospitalizations have remained stable. There are currently 964 people in hospital with COVID-19, including 47 in the ICU. Sadly, lives are still being lost to this disease. Over the last week, 30 deaths related to COVID-19 have been reported to Alberta Health. This averages just over 4 per day. My deepest sympathies go out to the loved ones of these Albertans. My sympathies are also with anyone who has lost someone they care about, no matter the cause. Even as we transition our approach to managing COVID, we know that the virus is still very much with us. It can still cause serious illness, complications, and even death for some Albertans. That's why we continue to promote vaccination, encourage individuals to make decisions that best suit their unique situation and risk tolerance, and invest in treatments like Paxlovid. As you may recall, Paxlovid is the first COVID-19 treatment approved by Health Canada that can be taken orally at home. It was first approved for use in Canada in late January, but due to limited supply, it was initially only available at 135 pharmacies across the province. I'm pleased to report that as supply has increased, beginning this Friday, any interested pharmacy in Alberta will be able to order Paxlovid treatments to dispense Paxlovid to eligible Albertans who have met the clinical criteria. As a reminder, Albertans who meet the eligibility criteria, which is available only by prescription, must call HealthLink to access the treatment. Staff will ask screening questions to confirm eligibility and arrange the next steps for getting the most appropriate COVID-19 treatment. Please do not call pharmacies or physicians directly to get a prescription, as they will be unable to give it to you. Paxlovid must be started within 5 days of symptoms, so if you are eligible, do not wait to see how things develop. Call HealthLink as soon as possible. If you aren't sure if you are eligible, visit the AHS website to read the criteria. While Paxlovid continues to be an option to prevent mild or moderate cases of COVID-19 from progressing to severe disease, it is not a substitute for vaccination. Vaccination remains the most effective way to prevent severe cases of COVID-19 and reduce the risks that come with getting infected. So if you have not received every dose available to you, please do so as soon as possible. If you have a child that still needs a COVID-19 vaccine dose, try to take advantage of the last day of extended AHS clinic hours and walk-in appointments tomorrow. A complete list of clinic locations and hours is available on the AHS website. Now, if you can't make it tomorrow, don't worry. Many pharmacies, clinics, and physician offices across Alberta can administer the pediatric vaccines by appointment. A complete list, again, is available on the Blue Cross website. Finally, I want to encourage all Albertans to pick up rapid test kits from their local pharmacy. As we're out and about and exposed to more people, it's a good idea to have tests on hand if we develop symptoms. The kits are free, and it's easier to get now more than ever, as you no longer need to show your Alberta healthcare card to pick them up. Once again, I'd like to thank all of our healthcare providers, our doctors, our nurses, those working in hospitals and volunteers for continuing to provide tremendous care for all Albertans through the last 2 years and through the most recent Omicron wave. Thank you, and now I'll take questions.
Thanks, Minister. No one in the room here with us, but I think a couple of reporters waiting on the phone, so we'll go to the first caller, please.
Jeff Slack, City News.
Hi there. Just wondering, with BA2 as the dominant strain now, and you were just mentioning that we are seeing sort of small increases in trends, do you think we're going to enter a sixth wave, or have we already entered a sixth wave?
We're going to have to wait and see. If we look at other jurisdictions, around the world and across the country, we have seen an increase in BA2, like an increase in cases. What remains to be seen is how big that wave will be, and then what the impact will be on our healthcare system. But as indicated by Dr. Tam in Canada, the expectation is that we may see a rise in cases, but we're still going to have to see what that how that may impact our healthcare center or our healthcare system. I can say there's our wastewater data is sort of the one of the leading indicators. We are seeing a slight uptick, initial uptick particularly in Calgary and Edmonton, but there's high variability in that, so we're going to have to watch and over the next days and weeks to see whether or not that is going to continue to rise.
Thanks, Minister. Jeff, a follow-up?
A lot of people I know who recently become sick say that it's kind of hard to get their hands on a free rapid testing kit. I was just wondering what are supplies at? Are we still okay, or are we running low on those kits?
Yeah, I don't have the exact numbers in front of me. We can get that to you. My understanding is that we have significant supplies that are in that we have distributed to pharmacies across the province, but we'll get you the exact numbers. I haven't heard any concerns yet about supplies, but we'll get you the numbers, and then we'll take a look at ensure that those numbers are also updated on the website.
Yeah, we'll follow up separately, Jeff. Thanks for that. So we'll go to the next caller, please.
Stephanie Thomas, CTV.
Hi, Minister Copping. Well, you did mention that COVID wastewater sampling that's showing an increased presence of the virus, especially in Calgary. So I'm wondering if perhaps your office or Dr. Hinshaw's office has some other data that you're looking at that might link that rise in the case detection in the wastewater to hospitalizations. Is that something you're seeing?
Yeah, we're actually seeing hospitalizations either being stable or continue to trend downwards. So we are not seeing a link at this point in time.
Thanks. Follow-up, Stephanie?
Yeah, so if it was to show that we are headed to, I suppose, another wave with severe outcomes, including hospitalizations, what measures is your office looking at implementing?
Well, we're going to have to wait and see first in terms of whether there is going to be first of all, are we at the start of another wave, one, and then two, what is the impact on hospitalizations? I do know, and again, you look at other jurisdictions, they have had an increase in BA2, which indicated there was a slight bump in cases in the community, and also a small bump in hospitalization. So there wasn't a need to actually take any measures at that point in time. So we're going to, quite frankly, we're going to have to wait and see. We'll watch. There's some other jurisdictions that are ahead of us on this. We'll watch what they are doing, and then we'll see, our own indicators of what actions we may or may not have to take. But again, it goes back to what is the severity going to be. I am comforted to some regards from a couple of points. First, we have relatively high levels of vaccination. For those over 12 plus, over 90% with at least one dose, and second doses and third doses are continuing to go up. There is some population protection from a previous infection from BA1, and we have broader access to treatment sites such as Paxlovid. So again, we're watching very carefully the numbers, and we're looking at other jurisdictions to assess the risk.
Thanks, Minister. We'll go to the next caller.
Alana Smith, Canadian Press.
Hi, Mr. Copping. I'm hoping you can provide an update for us just on Alberta's strategy for the rollout of fourth doses.
Yeah, I think Dr. Hinshaw spoke about fourth doses last week. At this point in time, for only the potentially for the immunocompromised, and not going anything further. We will rely on the expert advice from the National Committee on Immunization, as well as our Alberta Committee as well.
Follow up, Alana?
Sure, yeah. I'm also just wondering, are you hearing any reports of folks getting fourth doses who aren't yet eligible? And are those numbers of who's gotten fourth doses available online?
So I'll have to double check. We are tracking those who are actually getting fourth doses, so we actually have those exact numbers, so we can get them to you. My recollection is that given that we don't have a total population of what is quote unquote immunocompromised, we may not have a good percentage of that, or it may not be as accurate, but we can get you the exact numbers of the fourth doses.
Thanks for that, Minister. We'll take one more caller, so we'll go ahead with the last caller.
Brittany Gervais, Calgary Herald.
Hi, thank you for my question. I'm just wondering, if Dr. Hinshaw wasn't available for questions today, why wasn't the province's Deputy Chief Medical Officer of Health made available to answer questions instead?
Well, quite frankly, we didn't feel it was necessary for today. Dr. Hinshaw will be back next week, and if there are any detailed questions that we need to provide answers to, we can get them through our Steve and through the CMOH's office, and they can provide it.
Thanks, Minister. Brittany, follow-up?
Yes, thank you. Just wondering, with transmission increasing, what advice does the province have right now for people as they're planning their upcoming Easter gatherings?
So again, we are moving to a system of individuals living with COVID. So our first set of advice is we ask Albertans to assess their own risk, right? Understand what their level of comfort is, and then be guiding accordingly, as well as go get rapid tests, as indicated earlier today. If you haven't gotten all your booster shots that you're eligible for, please do so, and then continue to listen for updates from our offices as we go forward. But again, as we move into a position where we're learning to live with COVID, asking individuals to manage their own risk and be able to take actions accordingly.
Thanks very much, Minister. And thanks for reporters who called in. We'll wrap up there and see you next week. Thanks very much.